fertility pattern, which tells us, if you see a National Family Health Survey, that generally peak childbearing age is 20 to 24, whereas other country or other states of India which are showing decline in fertility contributed by other age groups. So it's a phenomena which is concentrated only in initial age group, which I think over the period when women education and work, labor force increases would turn to be contribution of other age groups. So looking into that age pattern, we need to frame our policy, in terms of age pattern. Now coming to the next, which is basically my talk was giving rural-urban differential or differential by other, background characteristics. But if you see theoretically, these are minor differences, but they makes a lot of differences adding people or numbers of children or citizen tomorrow you have. So if you bring that children's of coming from the poor backgrounds, we need life cycle, we need educational opportunity, good quality education for them. And therefore, as in the morning someone says that bring the quality of public education as good as quality of private education. This has an implication of having second child or more children in future, let me tell you, because my own example in Mumbai, I have a high paid salary. I still feel like 2 children is beyond my capacity, giving them very good education in Mumbai like city. So keep that in mind. You have to have, it is not earning, it is basically your insecurity about the, quality public education system. That is very important for any states and country. So not, much variations, but I would say that differential in TFR are here. It is little higher among lower educated women, but whereas even in 12 plus education women not that low. But surprisingly, you can see the no schooling, it is lower. So somewhere women thinks, or somewhere it is a maybe past effect of this digitalization that one has to look into seriously, whether women think that we have a lower fertility and that's why we can make our life better, our children life better, or it is the impact, which generally demographer thinks in past impact, which is low fertility amongst these women have already been settled. Now, I would like to go directly to these slides. So women are not settling with this fertility which is current. They still want, as the situations, lesser number of children. You see that yellow bar is what they desire, and orange bar basically which is additional fertility which they have. It means they are not settled with the current level. They still want lesser number of children. We understand what are those factors by which they are still wanting those, lesser number of children. Now, if you see NFHS 4 and 5 progress, 32% women after one child do not want any child, whereas now it has increased to 37, and some of the background characteristics, it has been much more. So we have to attend, if you see that no schooling after one child, a very high number of women do not want any child. So now coming to the next, women prefer another child. You can also see that want another child soon, when they have one child, 33%. Now in due course of time, they may have after having child certain changes in their desire. But however, as in the morning we said that it is not that number of children. If you see that ideal number of children among men and women, not less than 2. Why it is so? Because it is the question is asked in surveys like this. If you go back when you got married and you are asked to start now bearing children, how many children would you have? You imagine that you go back time. So couple are asked when you got married and you go back to that time and see how many children you would like to have. Then these are the responses. It means what? They want that more children on an average 2, but their life course events and decisions and necessities force them to have lower number of children. Now any state or government has to see what are their difficulties. Now there are some variation of course district wise, or you can see some district there is a little higher third order birth, but not much and not much differentials. It has low fertility norms is settled in whole states. Now with this I'm just closing my presentation. I would like to say 3 to 4 points here which policymakers should discuss further. Number 1, in terms of we are talking about fertility enhancement, and what already sir has made questions are that we need not to compromise on certain things. For example, wide basket of choice of contraceptives, and that has to be done under sexual and reproductive health rights approach, human rights approach, because sometimes it happens we have done now fertility, let us not do this. No, that will further fall back. We should not compromise whatever is spending on women's health or on couples' health or their sexual and reproductive health rights. So in this terms, I would say access to abortion services has to be maintained, because if you do not have quality access to abortion services, sometimes it makes women or couple as an kind of a version of the next pregnancy. Also, it may make women infirm, or maybe there are certain sexual and reproductive health diseases. So quality of abortion services has to be maintained in the in the policy. In addition to that, I would also like to point out that, which have been already, private sector is insensitive to women's, labor force, you can say conditions. You can give childcare leave in the government sector to women, but what about private sector? Number 1. Number 2, we also should be sensitive and involved men. I have 2 kids, I wanted to care my children, but I didn't have childcare options. Can you imagine that? Can this state do that? Now men also are, and therefore we have to have in school education, men should take care of family and children's household chores also. That life course education has to be introduced by, education department. My last point, which I would say that, basically, we can, as he said, that 3 burden we have to reduce on the couples or women particularly. First of all, mental health. Child care, house care is creating now a big issue because she is maintaining career also, she is maintaining also child care. It is creating a huge mental health burden. It is bringing women to depression. There are certain cases where women have actually taken extreme step. There are post, natal depressions cases very increasing. Economic and social burden, we need to reduce that. In addition to that, mental health. Now, in addition to that, every job has to be dignified. Now our, young people are delaying their marriage as well as their, childbearing. Process is starting. Why? Because they think, let me get to higher level, let me get to higher salary. These all are actually, it is not an issue in this state. It is I came from Sikkim, the same fertility is so low, the same thing happening there. So government has to create this. My final point is that
other countries also have shown, as Dr. Niranjan has already talked about this thing, when you have very strong program, family planning program, that too, I think Dr. Anand has also talked about it, on sterilization, the scenario will change. So under this thing, I have prepared a scenario, next slide. Oh, no, it's going, again there is a problem, there are, in case of Andhra Pradesh, how many remaining single in reproductive age group? It is insignificant, you can say only 1 country are remaining insignificant. So the impact of remaining single on fertility rate may not be there. The other component which also have to be seen, that was about widow, there's a diverse, separated women. So this percentage was more or less over the period of time, it's remained same, because previously it was more widows. Now the percentage of diverse and widow have, diverse and separated have little bit increased, not very much, but the percentage was more or less same. But it has been found in the study which we have also carried out, the fertility of this group is little lesser than the people who are in currently married status. So this may also impact on total fertility rate. The second one, the third component which I thought should also be highlighted, in case of Andhra Pradesh, basically I'm talking about Andhra Pradesh, here people are not delaying age at all. It's early, very early age. So the impact of this delayed marriage on total fertility is not there. So I wanted to examine the different components. The other one is that in developed countries or many countries, it has been found that people were postponing the first marriage. Postponing the first marriage, and where the countries are very much urban or the people are in employment, they also postpone the first marriage. But in case of Andhra, what is happening? 13% teenage pregnancies are there. So this is also not the case of which can decline the fertility. And the next component which I have looked at is voluntary childlessness, means people who are not going to have children. And in that, in the first parity, first this thing child knows living child, 3% have reported. This you can take this as a drink families or whatever you want. We do not have knowledge about whether the husband and wife were working or not, but only 3% reported that they do not want any more child, and not at all, they do not want at all. And the next one was the primary infertility. This has been observed, as it has been said in the morning also. In 90s only, I have observed that based on the census data, Andhra Pradesh has highest infertility rate. And I was trying to convince Government of India to carry out the research work, but it was not possible. But at the Ford Foundation Reproductive Health Program, I was able to do the study with the help of Ford Foundation in Andhra Pradesh. And what I have found is that 12% people have some lifetime infertility problem, primary infertility problem. So they are overcoming by taking treatment. So if you look at only current infertility, it will look like something 2% or 3%. But people are undergoing the treatment, and because of that, their infertility problem is solved. So that is not known to the people. Otherwise, in our mindset, we have this that it's a very small thing. But what we have found from NFH is also 5.2% women who are at present not having any child, they are declared infertile. They have reported that they are infertile. With one child also, around 3% have reported they are infertile. Means either after delivery, the not safe delivery, as it has been said, not safe abortion. So those things may be playing very much important role in this. So the overall, if you look at the component, I feel we need to think about infertility at much higher this thing than comparison about increasing higher birth orders to improve the total fertility rate, or maybe to maintain the total fertility rate. Basically, in case of Parsi population, when Parsi population was decreasing, then Ministry of Minority have started a project. They have started giving funding for IVF treatment. Okay, so. And when it comes to infertility, basically when we talk about family planning and all those things, people also have right to have children, and it also have very high impact on women's life. When we talk about gender issues, it has very high impact on women's health, and people are going for diagnosis to the private clinic and all other things. Not many services are available. And when I was doing survey, I have visited many hospitals and asked, they said only for one day we give the services. And why you are thinking about this thing? You are now worried about the population. Don't talk about infertility treatment. That was the argument given 20 years back. Okay, so just I wanted to highlight just one or two things about the. If you look at many governments and many people are very happy when they say that we have a number of PSCs and CSCs sufficient for our people, but CSCs are not sufficient. It's more 2.5 lakhs one CSC is there. And when you look at the specialized services in rural area, current situation in 2021, what is the current situation? Surgeons, specialized doctors and all those things, we have lot of shortfall. With this shortfall, if you want to improve or give services to children as well as aged population, then it is very difficult. And radiographers and radiologists, and that percentage is also, percent number is very less in case of Andhra Pradesh. So there is an urgent need to improve the infrastructure in Andhra Pradesh about the manpower as well as the specialized services when we think about giving facilities to elderly persons or improving the child health and maternal health. Okay, so in voluntary childless, as just now Dr. Chandrasekhar has also talked, and all those things, why people do not want, or why couple do not want to have this thing, children. Basically, there are 2-3 things. One is more motivational, this thing. Other one is economic hurdles or marriage instability. Sometimes it has happened that people are living in relationships, so they are not sure whether the relationship will continue or not, whether we should go for children or not. And the other one is childhood trauma, career. But in developed countries, this thing, the work and all those things had come out less when comparison to this economic factor and social factors. And voluntary childless education of women, it has been found it's not one-to-one relationship. Where we talk about education and fertility, it is one-to-one. Whereas voluntary childlessness, from the studies, it has been found it's a U-shaped curve. As it has been shown by the Chandrasekhar also, less educated women have no children, and higher educated. And same thing is coming out with the wealth also. This is a wealth U-shaped curve. And this estimate, how much is the cost of child rearing, it includes care for the child health, education, and all that thing. This are the ET, this thing, projected population. It's very high if you want to have good education, good care for the children. It's not easy job to have the children in this world, here also, or in India also. Already the points have been discussed about the family planning, which I do not want to highlight it. But just one point I wanted to tell about the family planning program, informed about other methods and side effects. The percentage is only 20% in Andhra Pradesh, whereas in case of Kerala it is 75%, and in case of Tamil Nadu it is 73%. So what it shows that our health staff, our program, people are not communicating to the people, or maybe we do not have services for other methods. That's why this situation is there where only 20% are this thing. And the other one is around 70% women are sterilized women are below 25 years. This has been shown by Dr. Anand also. And And this, I wanted to show it about the sterilization and hysterectomy relationship. And this has been found in some of the studies that there is a positive association between hysterectomy and sterilization. Whenever women is going for this thing, most of them were sterilized. And it has been said that when there is a dual litigation, then the periods and all those things, regularity will go down, and women have different health problems. Then it is suggested that hysterectomy is better. This thing. Other one is about hysterectomy and health condition, chronic health condition. If you look at health condition, chronic health condition, it has a big impact on the health of the woman. So when we want to have a better woman health, this is not possible with this. And in case of Andhra Pradesh, it has been found nuclear family percentage is increasing. Within 5 years, it has been found around 5% increase in nuclear families. It is now around 54.8. And this is also part of this thing. People are moving to Hyderabad, Bangalore, and all those things. And apart from that, they also have the problem of childcare because of nuclear family. Okay, this is my last slide. I've given less in this thing, and you need to think about what more we can add. So infertility services, maybe small this thing. You start with a small sperm testing or menstrual regulation and all other things, small thing at PSC level, then it will help them. And for voluntary childlessness, you need to talk about motivation, about how film actresses and other people are going, and childcare facilities. As it has been said by the Chandrasekhar, we are giving only women 1 year leave in government services. But what about the males? Sometimes women are not in government sector saying that she will get pregnant, she will require 1 year. This goes against women also. So if you have share of husband and wife in leave this thing, then it will be less burden on the woman. Other is family planning. It's not just for the control of the fertility, but we need to think about from the health point of view, hysterectomy, that it has a long-term effect. And in childcare, in other countries, developed countries, it has been said that it can be taken as a responsibility, community responsibility. Maybe self-help groups should be engaged in rural area to form a childcare center. In urban areas, societies or housing societies should have one childcare center where they can be taken care of this thing. In Anganwadi, which is already there in a rural area, below 3 children also can be taken. And elderly care, as it has been said, about 80%. In some of the societies, we call it as blue zone societies, where elderly people are living. And what they are doing is 3 component: health, social life, and economic this thing. I've seen social life in Punjab, Haryana, where people sit on the cart and play cards. Whereas when I was doing survey in Andhra, Karnataka, Tamil Nadu, I have not seen that type of social life at all in these places. And we need social life in the form of having some groups, having some exercises for them, and maybe balancing exercises for them to control this thing. And emotional this thing also. Social interaction will improve the emotional this thing. And they can have formed a group. They can also work for the child care as well as elderly care. And in case of Andhra Pradesh, education is not very high according to my this thing. When I have looked at 20 to 34 age group, what I have found, around 20% are illiterate in this age group, peak age group. So what they will do? So for them, something literacy programs can be arranged by elderly. All those elderly who are educated, they have knowledge. So involve elderly in different social activities to make them better, healthy persons. Thank you very much. These are my channel observations, suggestions. And one last slide. And we have last slide. Just show the thank you in that I have. Yeah, we need sustainable efforts for sustainable population. Thank you very much.
Thank you, panelists, for such an insightful discussion. We will now open the floor to questions from the audience. Our volunteers will be there with mics. If somebody has a question, you can please ask.
I am Dr. Deeksha, representing Vasaya Mahila Mandali in Vijayawada. We are doing a lot of work in teenage pregnancies, and it is very shocking to know that Anganwadis are not recording their age. Because they are teenage, below 18 years, they are not recording, so they are not getting the benefits of this. So government, my suggestion to the government is, please include teenage pregnancies also now, because of the precocious puberty which we see among the youngsters, and different social norms are there, disrupted families, all are these reasons. Can you just, Krishna Babu Garu, can you answer this, please?
Only thing is, I don't know how you got this feeling, because our statistics itself says around 10% are pregnant, means teenage pregnancies. So there is no bar for any conceived women to access the facilities. So we insist that they have to be properly registered and all the facilities given, both from Women and Child Welfare Department, that is nutrition kit, as well as health department for providing all other ANC and other medical help. So that is, we only think that because lot of IEC, lot of awareness need to be built so as to discourage these teenage pregnancies, because it is not good for the health of the girl or adolescent girl, you can say. So, but no way, means there is no bar in getting any, means all the facilities they will be able to get. We track also, because they are taken as a high risk pregnancies. So they will be tracked much more closely. So if at all any where something is being done unknowingly, maybe you can, you are anyway in touch with us regularly, you can bring to our notice. We can again reinforce the government instructions that it has to be provided, because they are much more on risky thing. So we should take care of them proper monitoring.
Thank you, sir, for responding. We can take another question.
Sir,
Hello.
Sir, namaste, sir. This is Kalpana Panchmati from Guru, sir, from Annavata. Sir, population dynamics, still now for controlling of population, we have had Tibet is incentive of living. Now we increase population, right? So why do we apply for Tibet in sir? And we can increase the amount of increase. Yeah, increase. They will go and sir.
We can targets we say that sensitive to to process them vector is quiet. So normally that particular force has now and it's only being available facility, not to go ahead. Only is so facility is available. That's what we are doing. Honorable Minister wants to and see the population benefit unity of more population. So this goes reverse. It's not a effect nowadays. So it's only now is will be coming. He has given a lot of issues for the number of children. One is that the package will be given to the child for education. Now the two limit. Earlier it used to be limit for two only. That is removed. Second, even maternity leave, it is given for children, not removed. So third, so and now benefits earlier more than two children cannot get elected in a public life. So that is also respect for the in some encourage the couples to have more children.
Yeah, I just tell you, I have two concerns to get it. First is right to family life. Child, as per international child rights convention, which limited a number of persons that increase. We have to address that concern. That concern is so now having a boom is a kind of my strategy. So these are two serious concerns which we address so that we can do. Thank you.
సార్ నమస్తే బాగా మనకి కనుగొన్నాము ఈ పాపులేషన్ పెరగాలి ఎవరైనా సామాన్య